Well, my guest this week is one of the state's most highly regarded leaders in the healthcare industry and the author of the book, Political Malpractice, How the Politicians Made a Mess of Health Reform. Joining me now is the former CEO of Integris Health and now author Stan Hupfeld.
Thank you.
Well, first of all, I've got to ask you, has healthcare become more political or more about politics than it has about health?
Absolutely. You know, we started this discussion about covering the uninsured. That was where we began. And I encourage people to listen to the debate today. We never hear anything about covering the uninsured. What we hear about from the Democrats, of course, is covering pre-existing conditions or covering your child until they're 26, which is insurance reform. What we hear from the Republicans is how bad it is and that the government's going to take over health care. The poor, the uninsured, where we started, have totally vanished from the conversation.
Let me start at the very beginning. Why would I, a person who has health insurance through my employer, and most of my friends have health insurance through their employers, why would we want to change right now?
Well, there's probably only one reason, and that is that the uninsured do impact what you're paying. They do impact what you're paying in premiums. They do impact what you're paying every time you go to the hospital. Because in the past and currently, there's hundreds of thousands of people in Oklahoma who do not have insurance, who eventually show up in hospital emergency rooms, for which policyholders ultimately pay their bill.
I think you said in your book, you know, President George Bush, the son, was derided for saying, well, we do have universal coverage. It's called the emergency room,
right,
which is our most expensive form of coverage.
Absolutely. And people made fun of him for saying that, but he essentially was correct. Now, is that proper care? Is it economically based? You know, that's the argument. But technically, he was correct. That is our form of national health care.
Why is our system, our healthcare system, so different than the entire rest of the developed world? Well,
there's a couple of reasons. To me, it seems we've not decided whether healthcare is a business or whether it's a social service. If it's a social service, is it like police or fire, where it's our responsibility as taxpayers to fund it through some sort of taxing mechanism? Or is it simply an entrepreneurial business and the swift survive? And working on your pricing structure, working on your profit structure is really where healthcare is. We're some of both. And that's what I think makes us different than the rest of the world. Now, there's some other reasons that make us very different. Our insurance system, for instance, is very different than any place else in the world.
Before we get into the insurance, I do want to talk to you about the legal impact, tort reform, and the fear over being sued in malpractice suits. How much of a cost does that have on our medical system? I hear a lot of different numbers.
Well, the Harvard study, which is probably the gold standard, says it's about $40 billion a year.
In comparison to what? $40 billion a year in comparison?
Added cost.
Added cost, okay.
Added cost. The point is that because physicians fear that they may get sued, they overorder. What I point out in the book is that's very true, but it's also in the physician's and in the system's best interest to overorder. The more we do, the more we get paid. And so our economic interest really support our fear of being sued.
So it almost seems like that's an irony, because what you've just described is probably better for the hospitals and the doctors because they make more money by overprescribing.
Right. The fear of being sued actually works to our benefit. It doesn't work to the public's benefit. So it's very true. Here's the interesting part. In 40 years as a chief executive officer of American hospitals, I can count almost on one hand the times we failed to do something. In other words, we didn't order the extra test and something bad happened and we got sued. What we normally got sued for is things we did and we messed up. So the fact is, we seldom get sued for not doing something. But that seems to get lost in the discussion. The fact is that physicians have a fear of being sued. That fear of being sued causes them to order more tests and procedures that need to be done. But also, the fact that they fear that and they do that also works in their economic benefit.
Interesting. You did mention insurance, and that is a large part of our healthcare system here in the United States. What, about 20% of our costs go to health? 25%. What are we doing right? What are we doing wrong?
Well, the first thing, it seems to me, and I go to some great extents in the book to talk about this, is we call it the wrong thing. We call it insurance, and we pretend as if it's insurance. So for you and I, you know, what's insurance? Well, insurance is that you take a little bit of money from the many to pay for the extraordinary losses of the few. That's insurance. So when someone throws a ball through your window at your home, you don't expect your homeowner's insurance to reimburse you for that window. But in the healthcare system, every time we have a contact with a medical provider, we expect someone else to pay the bill. Now, by definition, that's not insurance. That's a payment system. We trick ourselves by calling it insurance to start with. We're paying an organization to take a claim from a provider, to compare it to a benefit package, and to issue a check. That's a claims adjudication process. That's not insurance. And we spend 1/4, 25% of every healthcare dollar, this trillion-dollar business, goes to collecting bills. That's a rich source of cost savings if we were willing to change.
What about entrepreneurship? We've seen the growth in doctor-owned hospitals, doctor-owned surgery centers. How has that figured into healthcare costs?
Well, the problem with physician-owned enterprises is that the opportunity, at least, is to continue the overprescription, to do more than is absolutely necessary. Now, would I accuse physicians of doing that? Absolutely not. Are there physicians who take advantage of the fact that they have ownership in a hospital or an MRI or a CT scan or a surgery center, and as a result, patients wind up getting more than is absolutely necessary? I think you have to say yes, if that's their incentive. So it is a factor. Physician ownership is a factor in the cost conundrum.
What's my responsibility as a patient? What can I do better?
Well, you know, I've talked to a lot of physicians in writing this book, and almost to a person, the physicians talked about the pressure that they're under to do something for patients, even when they know that doing nothing would be better. The fact that patients, when they leave their office, if they don't have a prescription, if they don't have an order for a lab test or an x-ray, feel cheated, and that their dissatisfaction with their doctor is palpable. We see that, for instance, in this whole antibiotic issue, the fact that we put a lot of pressure on our physicians in the wintertime to prescribe antibiotics for what is clearly a viral infection. And that's the most perfect example. So you and I and the rest of the public are clearly part of the problem.
Do you believe that the advertisements we see and the commercials on television play into that role? I've had people tell me in the medical profession that once a big commercial run will start about a certain drug, then they get lots of questions about it, whether the patient needs it or not.
Yeah, the pharmaceuticals have figured this out, and they know that if they go over the head of the doctor and advertise directly to the patient for a prescription medication that requires a physician's authorization, they know that if the patient goes into the doctor's office and says, will you give me XY, will you give me the purple pill, that the physician is 80% of the time likely to write that prescription, because it is simply easier to give you the prescription than to take 15 minutes to explain why you shouldn't get it. And the doctors don't have that extra 15 minutes.
Because they're making money by seeing as many patients as possible.
Well, what do physicians sell? They sell time. That's all. That's their product. And the fact, if they have to take 15 minutes every time they see a patient to explain why you don't need a medication they just saw on the nightly news, that's one less patient they can see.
You know, I don't think any of us like to get old. And does Americans' view on death and aging, has that figured into our healthcare costs?
You know, the fact is that we do die differently in this country. You know, as I said in the book, there's this old saying that the rest of the world views death as inevitable, and Americans view it as optional. And there's some truth in that. So we do lead the world in high-cost care for the elderly. That gets to be a philosophical question, it gets to be an ethical question, it gets to be a legal question. But unquestionably, how we handle our elderly and how we handle death in this country is a great exacerbator of the cost. You know, our tendency is to put our parents at the end of their life in an intensive care unit at the cost of $100,000 a day in comatose conditions rather than let them die naturally. Our tendency is for a terminal cancer patient to get extreme treatment at hundreds of thousands of dollars of cost when they'd be better off with palliative treatment in a hospice care. So dying and how we handle old age is an issue, and it is an issue that does impact cost.
Now, a great part of your book talks about the politics of healthcare, and you're not particularly forgiving as our politicians as caregivers.
Right.
Why is that?
Well, it seems to me that for the most important domestic issue of our time, we've asked the very worst people to decide it for us. And on the one hand, you're right, I'm very critical of politicians. At the end of the book, I do acknowledge that running for political office is maybe the most difficult human endeavor. You expose yourself to such criticism. It costs so much money. It is so arduous. It takes such a toll. So is there any question that once you get there, you'll do anything to stay there? And I think that's where we are. And so, people bringing logic, bringing common sense to the equation is lost, and all we get is, very partisan bickering at the fringes of the discussion and very little conversation about what makes sense in the middle.
Yeah, I remember that part of the book you're talking about, that you lay out three things that politicians think about, and the very last one, is it good for everyone?
Right. And you never get to that part.
Yeah.
Unless you answer the first two, is will it help me raise money? Will it help me get votes?
Yeah. Interesting. When we return, we'll ask the question, does the United States have the best health care system in the world?